Hi, I'm Dr. David J. Rodricks, a Board Certified Fellowship-trained orthopedic surgeon that specializes in hip and knee replacements. And with the primary goal of those, of course, being able to restore patients to a high level of functioning activity. The hip replacements, we're able to do those through either an anterior or posterior approach, which are both very nice, and some are more reasonable for some people than for others. And the knee replacements are done through a minimally invasive approach, again, with the goal of these all being to restore people to a very quick, active lifestyle. New Jersey's a great state. I grew up at the beach in New Jersey, down in southern New Jersey. I'm a Jersey guy. I grew up with sand between my toes, and I can never be far from the beach. And that's my favorite part about being in New Jersey, is just being at the shore and being able to scoot over there any time of the evening or on the weekends and spend some time at the beach. Well, we always try to maximize conservative care. So the first time that we see a patient, we always try to look at what can we do to help them avoid surgery while still taking care of their pain and their needs and getting them back to that active lifestyle. So there's a whole host of treatments that we can offer patients without doing surgery on them, and these can range from anti-inflammatories, physical therapy, weight loss programs. Sometimes we can do some injections into both the knee and the hip, and all these things can actually put off surgery for a time period. Or if the patients really truly are at that point where they're ready to move forward with the joint replacement procedure, we counsel them about what to expect both before and after the surgery, so we know that we can meet their expectations. A patient should consider hip or knee replacement surgery when conservative measures have failed. They're having a lot of difficulty performing their activities of daily living. Again, if they're having trouble getting in and out of the car, going up and down stairs, getting off the sofa, if they can only walk a block or two because of pain, those are the most common reasons to consider that now is the time to have hip or knee replacement surgery. A lot of times that people don't even realize it, that they've been getting gradually so much worse and weaker over the years until all of a sudden a friend or a relative says, hey, look, something's going on here. You really should have this looked at and checked out. And the nice thing is that we're able to kind of, when we first see patients, take x-rays, do a nice good physical examination, take a good history from the patient, and really kind of help them decide on what the plan for them for the future is going to be. But the main reason that we do these replacements for is really for pain. There's some other reasons too. Sometimes people really have a lot of loss of motion or stiffness, or they have a very bad limp. So some patients have more of one than the other. So if somebody comes in, they really don't have much pain, but they have a terrible limp, and their x-rays and their hip is really destroyed, that's still an indication to do a hip replacement, because it's going to allow the patient to walk better. They're not going to put as much stress on their knee, on their back, on the rest of their pelvis, and it'll actually improve their quality of life substantially. The really exciting thing about hip replacements is actually what's called an anterior hip replacement. This is a relatively new procedure. It's becoming more prevalent throughout the United States. But instead of going in through our typical posterior approach through the posterior gluteal muscles, we come in from the front. The nice thing about this is it truly spares all the muscles. And we've had patients recover to full recovery and back to work actually as soon as 2 weeks after the surgery with minimal blood loss. And really it's a very safe and effective way to do hip replacements. And again, this has been shown to decrease the amount of time that patients are out of work or out of function or really suffering after their surgery. And then with the really quick rehabilitation programs we have, patients are on their feet either that day or the next day after surgery, and they can actually put full weight on the body part that we fixed for them.